Bismillahirrahmanirrahim. Assalamu alaikum. I am Dr. Zia Khwaja. I welcome all of you from the MMK Hub for today's lecture of parathyroid pathology. Parathyroid pathology is an important topic regarding theoretical, practical, and clinical aspects. It's the topic for which undergraduate and postgraduate medical students usually don't have clear concepts. So our aim is to clear your concepts and make the subject as simple as possible for you. Parathyroid disorders can be due to hormone excess, that is the primary hyperparathyroidism, may be due to adenoma, hyperplasia, or occasionally carcinoma. It can be secondary or tertiary hyperparathyroidism. It can be due to hormone deficiency, post-surgical, autoimmune, autosomal dominant, and it can be due to the hormone resistance, that is the pseudo-hypoparathyroidism or familial hypocalciuric hypercalcemia, and non-functional tumors such as the parathyroid carcinoma. We will discuss these conditions one by one. First of all, hyperparathyroidism. Hyperparathyroidism involves these four systems. First of all, digestive system. Patient may present with the loss of appetite, nausea, vomiting, or constipation. Nervous system. The presentation may be fatigue, depression, or confusion. In urinary system, there may be formation of kidney stones, increased thirst, and increased urination. And in the musculoskeletal system, there can be muscle weakness, aches, and pains in the bones and the joints. And most of these symptoms are due to the hypercalcemia, which is associated condition in hyperparathyroidism. So these symptomatology we have discussed in the previous slide. In addition to these four systems, cardiovascular system can be affected and patient present with the calcification of the cardiac valves. It may be due to the short QT interval and a wide T waves. And the general symptoms of weakness and fatigue can be there. What happened in hyperparathyroidism? There is a classical symptom of bones which are painful, stones of the kidneys, groans, abdominal pain, and cited moans. So it is called as bones, stones, groans, and moans. This is a classical presentation of hyperparathyroidism, and usually most of these symptoms are attributed to the increased calcium levels. This picture is just summarizing all these features, and we should memorize these features because most of the patients present with these conditions, and association of these symptoms may help us to diagnose the condition of the patient. Causes of the hyperparathyroidism can be divided into primary causes, which include the parathyroid adenoma, which is the most common cause, almost 80% of the cases. Then the hyperplasia of the parathyroid gland, which accounts 10 to 15% of the cases, and less than 5% of the cases are caused by the parathyroid carcinoma. And the symptoms of the hypercalcemia involving the renal stones, bones pain, abdominal groans, and cited moans. There may be generalized symptoms of the body wasting, bone wasting, and osteitis fibrosa cystica. We will discuss the pathology behind this formation of the osteitis fibrosa cystica shortly. The most common cause, almost 80% of the cases, is the parathyroid adenoma. Parathyroid adenoma is usually single, but it can be multiple in rare instances. It is a well circumscribed, encapsulated nodule. almost 0.5 to 5 gram in size. The cells in the adenoma are polygonal, chief cells with few axial cells, and minimal adipose tissue. The surrounding parathyroid tissue is compressed by the pressure effect of the adenoma, and the other glands are normal. Parathyroid adenoma usually involve one of the four parathyroid glands. Majority of the adenoma are sporadic, but 5% have familial association with the MEN1 and MEN2A syndromes, which are the multiple endocrine neoplasia and associated with other organs abnormalities. Second common cause is the parathyroid hyperplasia. In this, all the four glands get enlarged, and microscopically, there is chief cells hyperplasia or clear cells, usually in the form of nodules or diffuse involvement of the gland. So, we can diagnose whether it is adenoma or hyperplasia on the basis of the involvement of the parathyroid gland. In adenoma, only one parathyroid gland is involved, but in hyperplasia, all the gland size is enlarged. A rare cause of the hyperparathyroidism is the parathyroid carcinoma. Carcinoma size is larger than the adenoma and it is adherent to the surrounding tissue. And the reliable criteria for the parathyroid carcinoma is invasion and metastasis. There may be pleomorphism and mitosis is present, but it is not that reliable as the invasion and the metastasis is. Very much. If you have any query, you can contact us on our website or a WhatsApp group for any question.